Is there anything frustrating than having a great and enjoyable sex for round one and wanting to go to round two? You decide to go for the second round, but physically you're not being able to. Is there anything more frustrating than that? Yes, if that happens, there are a lot of causative factors, there are reasons to that, and it has a scientific name. There is a name for that. We call it refractory period. Refractory period. In most cases, men usually experience that. You see that you have an enjoyable sex, but you want to go for the second round after you have ejaculated, after you've enjoyed the first round, you want to go for the second round. But physically, you try all means to get harder and go for the second round, and it is not happening. And this is so much frustrating. Yes, I'm telling you, it's very, very frustrating. Don't worry, in this video, I'm going to show you why this happens. And if it happens, what are the means to resolve them? What are the possible causes and the means to resolve them? Stay with me in this video to learn more about refractory period. Yes, that is the name. We call it refractory period. Refractory period is the brief period, the duration following the response or after a response of a muscle or a nerve to a particular activity, and that relaxation period before it regains its capacity to respond again. So the duration that it takes, the period, the brief period that it takes for a muscle to respond to another stimulus, another stimuli, or the brief period that it takes for a muscle or a nerve to regain its ability to respond to other stimulus or other sensitivity. That time is what we call refractory period. So, in simple terms, the duration, the period that it will take for a nerve or for a muscle to respond to another stimulus, to regain its ability, its strength, its capacity to respond to any sensitivity, any stimulus, any reaction. That period that it will take before it will respond, it's after it has already responded to some. So if it responded, if you did, you activated it or you did something to it, you caused it to cause an action or perform an action. It has performed that. It has to relax for some time before it will respond again. So the period, the duration that it will take for this particular muscle or for this particular nerve to get its ability to respond again, that duration, that interval, that period is what we call refractory period. Now let's come back to refractory period in men or during sex. So now in men, refractory period is the period or the duration that it takes after ejaculation for you to respond to another sensitivity again. You get it? So the period, the duration that it will take after you have ejaculated or the nerves or the muscle, which is the penis, has ejaculated during the first round or second, whichever round that you were. The period between your first ejaculation and the second ejaculation, how long does it take for a man to regain the arousal or to regain the ability to respond to another arousal, to go for another round? The duration that it takes is what we call refractory period in men. So let's get to the reason or the causes, what actually causes the refractory period to happen, what actually causes this. It's all about hormonal changes. This refractory period that we're talking about it's all about the hormonal changes and balances that happens during sex and after sex. So we are saying that post ejaculation or after your first round, after you releasing and ejaculating, you realize that your penis becomes flaccid, and this is a signal being sent to the body to relax. So after ejaculation, the penis becomes so flaccid and not being able to become harder. And this sends signals to the body that the body needs to relax. Neural signals are sent telling the body that no, Charlie, you need to relax. And what happens is that what actually causes this flaccid penis and the need for the body to relax is that during ejaculation or after ejaculation, after you have ejaculated, the changes in the hormones. That's we have the dopamine and the testosterone. One, these hormones cause you to perform and become harder. Now that you have ejaculated, the level of the dopamine and the testosterone drops. This dopamine and the testosterone they drop, and then when they drop, they cause another hormone, that is the prolactin, to increase. So an increased prolactin will not allow you to get aroused so far as the testosterone level is down. So you see that there's a balance, or there has been a change. So what happens is, so far as there's high level of prolactin released by the pituitary gland, so there a signal is sent to the body or to the brain, that's the pituitary gland, then it releases the prolactin hormone. So far as there is increased level of prolactin hormone, which suppresses the release of testosterone and the dopamine. So, man, you have said that the testosterone and the dopamine causes us to become aroused, sexually active, to perform, to become harder, to erect, and to ejaculate. So, if the prolactin is released, what it does, it overshadows the testosterone. So now that the testosterone is overshadowed and it's not increasing, or it's not, I mean, it's overshadowed, yes, it's very low, and now the prolactin is high. Prolactin will not allow, will decrease your inability to get aroused again. So in that moment that there's that period that there is that sharp change, or let's say imbalance, it will take some time for the testosterone to also come back to its normal for you. So now the body needs to relax. The brain needs to relax for resettings and default settings to be done. You get it, so that the testosterone will also come back. So somebody may ask, how long will a refractory period take? Refractory periods are different from every man to every man. It differs. It's not the same for this particular guy and the same for this particular guy, because some men can take about less than few minutes, let's say 5 minutes or 10 minutes to recover. Some too can take less than 30 minutes, some can take 1 hour, some can even take about a whole day and even weeks to recover or to gain their ability to go for another sex. And also, you may have noticed that at a particular point in every person's life, you realize that sometimes you have a shorter refractory period. Some other days you have a longer refractory period. It all depends on the age and your overall health, and even the kind of arousals that you get in between sessions. So refractory periods doesn't have a stipulated time that, oh, automatically after 2 hours or after 1 hour or after 30 minutes you have to regain. No, it depends on a lot of factors. That's the age, the overall health of the individual, and the type of arousals that you get in between sessions. So it differs from men to men, from one person to the other. And even you, one person, you yourself, you'll be having different refractory periods differently at a different point or at different stage in life. Okay, so some may ask, do women really face or also experience this kind of refractory period we are talking about? Yes. On the other hand, women generally don't have this refractory period. Women generally have a lesser or a faster refractory period. They tend to recover as quickly as possible, or even some don't even have at all. You get it? Most of the time, like not at all, or they recover fast because women are multi-orgasmic. When you say multi-orgasmic, they can experience the episode over and over and over within a particular session. Even at a go, they can have this feeling or this experience over and so we call like they are multi-orgasmic. They can go through the episode or the system, or they can experience the orgasm within one session. So what you're saying is like they most of the times have that ability to recover faster than men. And some don't even have that refractory period, they feel that they have to wait before they will gain the sensitivity again and stuff. No. But that does not also mean that when your woman is not ready for it, sometimes what happens is after they've also gone through the ejaculation and stuff, the body also has or experiences some hormonal changes which sometimes pushes them further from having another episode or doesn't allow them to enjoy it again. But Sometimes they do have the ability to go for a second round or third, or most of the times they will prefer, and we are not worried to go for how many rounds that you want to go with them. But you just have to ensure that they are ready for that. Yes. So what can we do to shorten or to um, what can you do to shorten the refractory period? Is there any way that we can shorten the refractory period? While it's a good idea to allow the body to relax so that it can regain its ability to go for second round or round two, there are a few techniques or points that we can note or practice to also shorten our refractory period. Number one is, so the arousal can be in any form that you know. Is it maybe licking, holding, touching, talking something dirty, trying to, anything that you know you can do to your partner, you know it can be done to you to arouse you sexually. You motivate that to be done so that it quickly sends stimulus to the body that, Charlie, you need to get up again. You can't just be relaxing. You need to quick, so you just do those things to quicken it. You get it. So increasing the arousal, trying as much as possible to arouse the body. I mean, trigger sensitivity, trigger reactions, trigger something to happen. It's one of the shortest way to, or one of the best ways to shorten the duration that it will take for us to get erection again. Another point too is you getting fitter, because we said that one of the causes depends on your overall or general health. So in terms of health, get fit. The fitter you are, the better your ability to regain or shorten your refractory period. So you have to try as much as possible to get fit, work on your health, work on your diet, your exercise level, everything, so that your ability to regain or shorten the duration of refractory will be short, or you'll be able to regain your sexual desire as quickly as possible after you have enjoyed the first round.